There's something, doctor, called pelvic floor physical therapy. What is that mothers can do after giving birth?
Well, I think that any type of exercise to strengthen your pelvic, whether it's to your Kegel exercises or any of those exercises, are going to be so important for you. Now, the majority of patients in the first week or so are not too concerned about it, but there are some issues and some patients that develop some pelvic diastasis, in which there's a separation of your pelvic, which is a very painful process, happens usually in a normal delivery, and those patients need pelvic therapy right away so we could get those bones aligned back together.
He said Kegel exercises, and I started doing them. Did you?
I didn't.
So he says, oh wait, hold on, pelvic floor lift.
Are you doing that, by the way? Do you do them?
Oh yes.
You really
yes,
do?
Definitely.
That's so funny.
Especially when I'm nursing, because you feel you feel contractions, and it reminds me, oh, lift to the pelvic floor.
Look at that. And how does that help, doctor? Just out of curiosity.
In general, remember that the vaginal walls are laxative secondary to the hormones and allowed for the baby to come through the birth canal. So all that muscle that has weakening, not really weakening because of anything, but because of the hormones and everything allows for the baby to come down, has to get strengthened. So that strengthening, the exercises will help significantly with that. And as she described earlier, those contractions of the uterus, remember, oxytocin is produced by the milk, which is the same hormone that is given to patients to go into labor. I mean, instead of giving oxytocin, you would do breast stimulation, would be the same. You know, when we used to do a oxytocin challenge years ago, it was produced by breast stimulation, not by giving oxytocin. And those are going to cause contractions in the uterus, which you're describing, which is breastfeeding. She's going to feel exactly the same contractions. I'll remind her to go ahead and do her exercises.